working as a family partner in the community, we're needed. We are their advocates. We are their voices for when they can't be heard or when they're not being heard.
It has been game-changing. When I started here, we didn't have any social workers on staff.
When the foundation was thinking about this idea, we looked at all the doors through which we might be able to meet these children and these families. The door through the health centers was the most probable pathway of reaching the most children and the most families in Massachusetts.
Both of my children were placed outside into residential schools at young ages. It would have been nice to have had a family partner. Yeah, it would have been very nice to have had something like that.
There's now an increased demand, and we have very little supply of folks in this mental health workforce.
Every child has access to education, and every child has access to health care, pretty much in Massachusetts. But so few of our kids had access to the behavioral health services that they needed, and so many of our children were suffering because there was a challenge that kept them from learning fully, from living the lives that they could live, because they were being plagued by behavioral health concern.
What attracted us to team up was not just the fact that it was taking an incredibly complex problem, how do you improve treatment and care for and address children's mental health, but doing it in a very different way.
There's clinicians of all levels of training, but I also think we need to integrate our community health worker as part of that continuum of the workforce. They can also meet this moment for kids and families. Then how do we make this pipeline more diverse than it is in the present day? How do we train our current workforce to work with people from all walks of life?
I came in as an interpreter. I speak Portuguese, Spanish, and I worked with them for a while in the Brockton neighborhood. Gave me opportunity to go to school, to have some flexibility. I was able to get my bachelor's, and I just graduated and got my master's. So I was able to come from an interpreter to a community health worker, and now I became a behavioral health clinician.
I think about what it would have been like, for me or my friends or anyone I know to have had the ability to call my PCP's office and say, hey, I'm struggling with anxiety right now. I'm struggling with feeling overwhelmed. And they were like, no problem, we'll get Sue's over here. She'll call you. How much different it would have been had those people been within reach to us. And would that reduce the stigma of mental health too? If it was that accessible, if everyone was like, yeah, of course I talk to my social worker, my PCPs, why don't you? Because it's just normal now, right? That would have made a big difference for a lot of people.
I had a 13-year-old girl who was scheduled to come in to see me for a routine annual physical exam for school. As I continued to talk with her, it became clear that she was depressed. And she hadn't talked to anyone about it. She hadn't talked about her symptoms to her parents, her friends, her siblings, her school support staff. When I invited her mom back into the room, it was really difficult. I don't think there was anything easy about it. The patient was crying, the mom was crying. I had the opportunity to bring in our integrated behavioral health clinician to help with the conversation. What the mom said was, I didn't know, and I don't understand, and I don't know what to do. And afterwards, as I was driving home, it just struck me that there's so much about the day-to-day work that's not easy. It definitely didn't fit into a 15-minute appointment slot.
Let's talk about why you're not sleeping. Let's talk why your appetite's off. Let's talk about why you might have thoughts of, harming yourself, and kind of validate those feelings for people who may have never had those conversations before.
I have a lot of responsibility, but that comes because I love what I'm doing. My co-workers, the staff, the providers trust me.
I want to look back to the 7 health centers that have really put in the hard work in a way that is completely also meeting this moment of the increased crisis in children's mental health care, and want to celebrate that the model that has been developed is one that both provides timely, responsive care that helps both the workforce, the people who are delivering the care, and everybody is working at their highest level, and they're working in a way that they're more satisfied and feel more confident in what they're able to do because of the team.
The colleagues that I work with are wonderful. Everyone is so supportive, and we're all a team. It's very gratifying to be able to be here and celebrate with folks.
The policy environment in Massachusetts and increasingly in other parts of the country is really looking for these sorts of comprehensive models.
In no way is Team Up the only answer, but we're excited to have been part of building some sort of answer to the problem.
The best use of philanthropy is demonstrating something and something that should be in the public realm, and having insurance, whether it's public or private insurance, recognize this is the way that care should be delivered.